Good evening, everyone. Thank you for joining us tonight. I'm Rod Fowler. Megan Conway has the night off. We've been looking into the mayor's budget here in Lincoln and the plans that support babies. One idea includes home visiting, which would support new parents. Channel 8's Jessica Blum joins us now with more on that. Jessica.
Home visiting programs help parents with the many challenges that come with raising babies and young kids. Studies also show home visiting more than pays for itself, according to the nonprofit research organization RAND. Every dollar invested can save over $5 in the cost of raising kids. Many have no way to afford the help home visits would provide. Supporters say there are several benefits that will ultimately make our community that much stronger, including prevention of child abuse and neglect.
I think it's very important, not just for the well-being of those mothers and children, but for our community as a whole, especially when, at least statewide in Nebraska, about 50% of our pregnancies are Medicaid financed, which by itself suggests we have some financial stress on many of these young families.
The local nonprofit first-five-Nebraska supports the plan and says healthy moms and babies are critical to ensuring a long-term success of children and families in our state. With the mayor's budget plans, the Lincoln-Lancaster County Health Department is proposing a new home visit model. First Five adds the mayor's proposal guarantees every infant born in Lincoln will have the support they need.
It's a new model called the Family Connects model, or the Durham Family Connects model. And it offers families support directly out of the hospital. So before they're discharged from the hospital with a newborn, that hospital can offer them the opportunity to receive 3 to 4 home visits after the birth of their child. And what's neat about what Lincoln-Lancaster County is offering is that it would be every baby and every family would be offered this service. Not everybody has to take it. It's completely voluntary and optional.
There are 26 different home visit models across the country, with 4 models used in this state. However, this new model will be focused on the medical care for newborns. In Lincoln, about 8 registered nurses will be fulfilling the home visits, according to First Five Nebraska.
Bringing a baby home is something that is overwhelming and can come at it can create a really vulnerable time for a family. And so having the opportunity to know that a registered nurse will be visiting you 3 to 4 times to offer support to you and your family.
In 2020, there were over 3,700 births in Lancaster County, with over 1,000 of those births to single mothers. First Five Nebraska says this model could provide support in the future to those families when they are most vulnerable. First Five also says home visiting is highly effective when it comes to identifying cases of postpartum depression as well, and addressing it quickly before it becomes a danger to moms and their babies. As for the final vote on this matter, City Council meeting is set to meet again for it on August 22nd.
Very interesting. All right. Jessica Blum, thank you for our top story.